And so we onboarded our telemedicine platform, which is AirVet, in December. And we're using it as a hybrid. So the pet comes into the building, but the owner can't. And so we're doing a video chat during the visit. And then we have the ability to video chat for other purposes with the client outside of the visit time. We have been using it now for about 2 months, and we're getting really great feedback from our clients. So we are trying to expand it into other uses, like our pre-surgical consults we're doing on video, not necessarily the visit because you need the exam and the blood work, but the last call to the owner is with a nurse via video, going over last minute details. The discharge calls are going to be on video to help people. You can see the incision. We can talk to you about things, show you things that we're not able to do right now because of COVID. Now we're working on getting digital signatures for sedation consent, treatment plans, things like that, that we can get to the client through AirVet's platform, and they can sign through their phone and send back to us. We're also working on digital pay options. So people are at our door needing things, and so anything that can make that process more seamless, whether it's check-in through the platform or check out through the platform, we're hoping to expand into all of those uses. We have a really diverse clientele that's on the move a lot. So even pre-AirVet, we were doing a lot of like phone calls to people that couldn't come in, like they're calling from the beach, but they're having an issue. So I think this will always serve a purpose for that. But the real benefit, if you go to New York City hospitals now, or you go to see your doctor, when you check in, you're like at an iPad, checking in a couple things. You're not really talking to anybody, and it's making it so much more efficient. So I think those benefits that are coming out of COVID and like needing to enhance efficiencies are going to stay and make things so much better in the office in terms of getting clients in and clients out without that backlog that happens when you're admitting 5 people at once or discharging 5 people at once. I think it should be at the forefront of expansion in this time, because I think everyone shares this concern that we're now so busy, we're having trouble dealing with the capacity, right? Everyone's too busy, they can't get their patients in. So anything that can make you more efficient, I think is really important to focus on. And I think that at least for the platforms that we looked through before we made our choice with AirVet, there was efficiencies that were really, really valuable, like being able to check a client in 3 minutes instead of 13 minutes is a huge difference for us. Being able to check them out before they arrive, like having everything ready for them, makes a huge difference. And if you do that 10 or 15 times over in the day, you're getting hours back in your day that are really valuable. And clients kind of have this expectation, regardless of age or demographic, that like maybe they could chat with their doctor over the internet. So I think what AirVet has done has, they have a whole concierge team. So they've just made it so easy for us. Like if we have an issue, we're a text message or an email away, and they're servicing a lot of the back end issues for us. So it doesn't feel that stressful. But I think that the best advice for somebody who's not sure is to just talk to these platforms and see what they can offer, and make sure that they have a lot of support with the onboarding, that they're going to handhold you through it. Because of course there's transition, and every transition is difficult, but if you can get support from the provider, I think it's really helpful.